Now, the availability of essential goods and medicines and restrictions on movement are not the only concerns that many of us are facing during this nationwide lockdown. Senior citizens are among the most vulnerable at the moment, both to the coronavirus as well as the loneliness that comes with a lockdown. It's brought stress and triggered anxiety in many. Here's tonight's special report on old and lonely during a lockdown.
The 21-day lockdown has left the common man in a fix, with most of them concerned over availability of essential goods. Some have additional challenges to deal with, like mental stress and anxiety. Senior citizens are more vulnerable to the novel coronavirus, and the ongoing lockdown is only adding to their worries.
अभी पूरा देश बंद है, एक वायरस से लड़ने के लिए एहतियात दिए जा रहे हैं। मानसिक स्तर पर आप लोगों के लिए ये कैसा समय है?
ये मतलब मेरे लिए तो अच्छा नहीं, मुझे दूसरों का पता नहीं है। मतलब रात को नींद भी कम आती है और मतलब ये सोचते हैं कि कब ये नॉर्मल हो जाए।
Not just senior citizens, even young couples are finding it challenging. 34-year-old Lalit and his wife Aradhna are still looking for ways to cope up with the mental stress.
Actually, इनको घर में रखना बहुत मुश्किल काम है। पहले ये होता था कि चलो स्कूल चले जाते हैं, 3 आवर्स के लिए हम फ्री हो जाते हैं, लेकिन अब बिल्कुल ऐसा हो गया है कि जिस रूम में है उस रूम में ध्यान देना पड़ता है। कई बार स्विच बोर्ड में फिंगर्स डाल दी या कुछ भी डाल दिया, सारा दिन इन पे ध्यान रखो या काम करो। काम वाली की छुट्टी अलग है।
Their concerns do not end here. What worries them is how to explain it to their little kid that he can't go out to play with his friends anymore.
हम मोस्टली टाइम हमारा काम पे रहता है, हम घर में रहते नहीं है इतना। बड़ा बच्चों का बार बार बिहेवियर चेंज होता है, बच्चे चिड़चिड़े हो रहे हैं, बच्चों को बाहर लेके नहीं जा पाते। मदर को एक आदत हो चुकी है कि मदर ऑल टाइम के साथ रहती है, हम नहीं रह पाते। हमारे को एक बार सर दर्द हो जाता है कि नहीं यार इतने क्यों चीख रहे हैं, हम उनको करते हैं बेटा शांत हो जाओ, पर नहीं मानते। बट ठीक है, उनके अकॉर्डिंग हम अपने आदत को वो कर रहे हैं, चेंज कर रहे हैं।
The lockdown has thrown up many challenges, not just in terms of restrictions on movement. Anxiety is taking a toll on many. With Ashutosh Mishra in New Delhi, Bureau Report, India Today.
It leads me to ask some big questions tonight. What will be the social cost of an extended lockdown? Can a lockdown trigger mental health issues, especially among the old? How can we cope with lockdown stress? These are some of the questions I want to raise tonight. I'm joined today by Dr. Vikram Patel. He's Professor Global Health at the Harvard Medical School and seen as one of the world's leading clinical psychiatrists. I'm also joined by Dr. Harish Shetty, psychiatrist. I appreciate both of you joining us. I want to come to you, Vikram, first. How do you see the social costs at the moment, the impact on the lockdown on the average person who is isolated in a sense at home, can't go out, and will be forced to stay at home for a couple of weeks? What are the social costs at the moment that you're seeing of this lockdown?
So Rajdeep, I think a lot of this depends on how swiftly the government implements its inclusive policies, particularly to address the needs of the most poor and vulnerable sections of our society. I think it's important to remember that in India, we have the largest number of absolutely poor people in the world, and we're a deeply unequal society. And as we're always taught in medical school, poverty is the mother of all diseases and deaths in our country. If this lockdown doesn't address quickly the very extreme and acute poverty that is going to affect tens of millions of Indians, then we may inadvertently find that a policy that was intended to prevent deaths due to the COVID-19 virus might in fact lead to increased deaths due to a range of other poverty-related diseases. I think I'm also very concerned about the fact that there is a diversion of healthcare. I've already seen it, in fact, with friends and family. For example, people who have diabetes are unable to get their dialysis or continuing care. And I think it's extremely important for the government to emphasize that that existing healthcare for existing chronic diseases must not be stopped, must not be affected by the resources and attention that we are paying to COVID-19. And finally, let's be quite honest, there is a wave of panic and fear that is engulfing the country. There is increasing anxiety about being near people. And I think this is going to contribute to loneliness and stress-related mortality as well as morbidity. I mean, ironically, Rajdeep, my bigger concern is that if not properly implemented to keep in mind all these vulnerable groups,
Yes.
this policy may actually land up doing more harm than the good that it potentially could do.
You know, I precisely want to take off from where you left, Dr. Patel, because the psychological cost, you mentioned loneliness and what it can do. There are senior citizens who are alone. There are students today who feel disoriented, their exams have been put off. There are salaried people today who are fearing losing jobs. There are even affluent who are fearing that their business is down. You are in Goa, where I'm told a number of people have not been able to get their essential items over the last 24, 48 hours. What are the psychological costs that this has on someone's makeup, mental makeup?
Well, I think we can already see the psychological impact, Rajdeep. There have been isolated cases, but they will definitely grow of people committing suicide because of the fear of contracting this disease. There is enormous panic and anxiety in all sections of society, but I want to highlight 3 or 4 really vulnerable groups. Of course, the poor as a bigger group is the most vulnerable, but I think within that there are certain sections that are particularly of concern. The first is the elderly. Quite rightly, you pointed out the elderly, because they, of course, are receiving messages that the lethality of the disease is particularly enhanced in that group. But also the elderly are very vulnerable to loneliness. The second group is young people whose entire lives have been thrown asunder by all the changes due to COVID-19, young people who are giving exams, etc. And young people, of course, are a particularly vulnerable group when it comes to mental health problems, because this is the age when most mental health problems actually have their onset. I want to also speak to 2 other groups, Rajdeep. One of them are people who have been affected by COVID-19 or exposed to it. It would be scandalous if people who have been affected by this illness, and in particular the healthcare providers who are putting their lives on the line to treat people with COVID-19, are stigmatized and discriminated against. And I think we must do everything in our society to show compassion towards this group. And finally, people with chronic diseases and in particular mental illnesses. I already know individuals, for example, with conditions like schizophrenia, who are running from pillar to post to find medication or a doctor who can actually continue their prescription. I fear that these individuals might relapse if we do not, in fact, attend to their ongoing and current mental health and other physical health problems.
You've given us the big picture, Dr. Patel. Let me come to specifics, Dr. Shetty. What do you see are the tips? What tips would you give today to our viewers? Say they are senior citizens, they have young teenagers who are perhaps not getting their exams being done on time. What are the tips you would give to families and senior citizens in particular to overcome this spell of being completely isolated in a way?
First thing is, tell yourself that you are trying to fight a virus from whom you have to stay away. It's like in a flood, you stay indoors. In a village, you leave the place. So telling yourself that you're doing a big service by staying away from the virus, and that, I think, has to be told to the person himself. And he has to tell it himself so that he can impact others. Now, as far as young boys are concerned, very important to use gloom busters. Gloom busters are things which we all use in our own lives across time. Somebody is a good storyteller, somebody is a singer, a dancer, a writer. Somebody just sits down and can do things very, very differently. In a fast-paced world, where the world has been disconnected, coronavirus has helped us reconnect to ourselves and to people around us. And that, I think, is the most important thing. The second thing is, 1 out of 5 people who end their lives with suicide are daily wage laborers. And this is a group they will have to work on very, very hard. The third thing is, when you use gloom busters, also use very creative ways of handling things. So from disconnection, you have to come to reconnection. If your marriage is going well and if your spouse is alive, picking up the album and talking about the first days of marriage also is a gloom buster. With the children, you can dance, you can sing, you can do yoga. All the other things are quite all right, but you'll get bored doing this all time. So at times, pick up small pictures of birthdays which has happened years ago,
right,
and live that story as of now. Living stirred feelings now.
So you're saying
and
create those
experiencing it is
gloom
also
busters.
a big
Right. So you're talking about gloom busters. You're
Absolutely.
asking people to look
I
for
would
gloom
just
busters.
want to add,
Yes. Go ahead.
and just 10 seconds. I'm worried about the mental ill, as my friend Vikram said. I don't know why the government has not yet come with FDA rules which can relax the prescriptions for the mental ill.
Right.
I get calls across the day where old prescriptions are not honored, and new prescriptions, soft copy, are not given, are not honored by chemists. It's not their fault. Why does the government not yet relax the FDA rules for a short time,
Right.
so that soft copy prescriptions are used by the mentally ill? Otherwise there'll be suicides, there'll be psychosis, there'll be panic attacks. This is a very small intervention. I've been writing to the PM and the health minister so often, so many times.
Okay, let me just go back to Vikram
And it's
for a
still
moment.
not done. The other things with
let me get Vikram in back again. Vikram, you know, the whole issue is the buzzword is social distancing, which in a way has all kinds of connotations. It affects our mind perhaps and the way we relate to others. Stay at a distance. Now, this is a highly networked society. Indians love to be in crowds. Do you see social distancing becoming a potential source of disruption in our lives? How do you see it playing out in relationships, Dr. Patel?
So first of all, I want to say I hope very much that people do not see the word social distancing as distancing between human beings at an interpersonal level. It really should have been worded physical distancing. But there's another very particular concern with this term in India, and I actually read about this in a newspaper article written by Yogesh Jain and others, where of course, you know, we live in a country where social distancing is also deeply connected with our historic caste system. And it struck home to me that, you know, the word might only further reify some of the caste hierarchies that continue to affect so many Indians around the country. But let me turn to something positive, Rajdeep. I think this lockdown can be turned to our advantage. It is a unique opportunity for the government to rebuild our public healthcare system and our surveillance system. Because let's be very clear, the lockdown does not eliminate COVID-19. It only kicks the can down the road. The virus is going to affect Indians. It's just that we are going to slow its spread when the lockdown actually is ended. So we have this kind of golden opportunity to prepare the public healthcare system for, as it were, what's often called the flattened curve. Another really important thing the government can do in the coming weeks is to test. This is, of course, the single most important mantra the World Health Organization has been calling for right from the outset. We need data, Rajdeep, not just models that are prepared based on American or Italian data. We need actual data from India to settle the question of how much community transmission is happening, and especially where, because the whole country isn't one place.
Right.
And I think the government should use this data to begin to ease lockdowns wherever there is clear evidence that there is no community transmission, so that life can begin to slowly return to normal, at least in those places which are not affected. And finally, I think we need to use this time to emphasize the delivery of basic services. And by basic, Rajdeep, I want to emphasize the need for basic services to include local transportation. It is absurd that people are being asked to walk from one part of the country to another. It is absurd that there are only 2 or 3 shops open in the neighborhood. Can you imagine how paradoxical that is? It means that there are more crowds of people collecting at those shops in order to buy food. It's exactly the opposite of what we want.
Right.
Let us try and have a lockdown with some sense that there needs to be essential services available to everyone in the community without the risk of overcrowding the few services that governments are allowing to operate.
You know, those are all fine points, Dr. Patel, and I want to, in a sense, return though to the question that really troubles me: senior citizens, you know, those above 65, those who feel detached in a way from the world around us, who are, you know, feeling lonely as it is, and now perhaps their sense of loneliness increases. What would you advise senior citizens in particular to cope with? How do they cope with this lockdown?
So again, you know, we are a very diverse country, Rajdeep, but there is no one solution that applies to all older people in our country. Remember, there's a huge number of older people who live in our villages who don't have access to phones or digital media. And therefore, when we tell people to do WhatsApp and do Zoom link-based teleconferencing, it's almost an absurd kind of suggestion for them. I think for them, it's important to remember that the epidemics, at least so far, does not seem to have spread into rural India. So continuing their normal social interactions, but maintaining the practices that, as far as they can, maintain the practices that are of good hygiene. For example, physical distancing with others, where possible, washing your hands, etc. You know the whole drill. In those parts of the country where elderly people actually do have neighbors with whom they have a contact, I think that contact should continue. Again, maintaining the same kinds of principles that I mentioned earlier. For those of us who are fortunate and we have access to digital media, of course, we can also remain in contact with one another using those media. But really, I think the message isn't so much for the elderly people here. I think the message is for those of us who have elders in our family. I think it behoves us to reach out to the elders that we know are isolated. They may not even be our relatives. They may be someone in the building that we live in who's living alone, and we know they're living alone. Knock on their door and ask them, do you need milk? Do you need eggs? Do you need some food? Because can you imagine how difficult it must be if you're living alone and elderly to just actually replenish your larder at a time like this? I think small acts of kindness and compassion will go a long way to save many, many lives.
Small acts of kindness and compassion. Dr. Shetty, you want to also take that question? What is your prescription for senior citizens? They are the ones many believe who are often very vulnerable at times like this.
I think they need to kill shame and seek help. That's number one. Number two, the younger people in the same locality, in the mohallas, in the chawls, in the villages, and in the buildings need to go and reach out to the elderly. Don't wait for them to come to you. Don't say they have not come. Mark those families which have single women or single men or elderly people staying, and knock at the doors and offer food, offer medical help, and offer support and offer company. I think these things are extremely important. At the same time, those who are taking medications for the mental ill, we need to take extra care. Also, the families of the elderly who have been staying outside need to talk to them many times a day and not only once a day. I'm talking to a mother at least 5 times a day.
So you're saying
she's
talk,
84 and she's
so
in
you're
a
saying
far-flung village in Bangalore.
You're saying talk much more. You talk much more to the elderly. Let me come to another group. Let me come to another group that troubles a lot of people, health workers. A lot of them are under strain, Dr. Patel. Their family is going through this strain because they are in a sense on the front line. How do they cope up with the stress of dealing with coronavirus, of being in the front line in the war against coronavirus?
You know, my heart goes out to the healthcare workers. They are the true champions of this entire exercise. They are the ones who, as you say, are putting their lives on a line, and particularly the nurses. The nurses are the people who will be running intensive care units when people come in and require ventilator support. And my heart goes out to them. I would hope very much that the government makes sure that every single healthcare worker who is exposed or likely to be exposed to people who are infectious are going to be fully protected with the kinds of protective gear that is being recommended by the World Health Organization. Again, we have still very small numbers of people at a national level, minuscule numbers actually, who are requiring intensive care. This is a great time to equip ourselves with all the medical equipment that we need, from testing kits so that we do massive community level testing, so that, as I said earlier, we can look for community level transmission and plan with data on our side how we can actually respond to local level realities. And secondly, to equip our hospitals and particularly our nurses and anesthetists and others who are going to man the ICUs, the emergency doctors, with the necessary equipment to protect themselves from getting this infection. And of course, let's be honest, we also need mental health care for these individuals. And so when they need it, it should be easily accessible and available.
You know, houses, Dr. Patel, are being marked in the national capital. Apparently by the state government, this is the house of someone returned from a foreign place. I saw it in my locality today. You know, they say that this is a house where someone has just come back from abroad. Do you agree with this kind of, dare I say, stigmatization?
Oh, I think my answer is very clear. It's the latter. Hey, you know what? The one time in history I remember we did this was during the Nazi regime, when people who were Jewish had their houses marked with a Jewish star outside their houses. Goodness me, there cannot be anything worse than that. The branding of people because they suffer from an infectious diseases has a very dark history, and I hope very much that whoever did that policy will correct it immediately and make sure it doesn't happen again. Let me tell you today from a friend, I received a WhatsApp message with the names of the 3 people and their addresses. who have been identified to have COVID-19 in Goa. I was absolutely horrified. Of course, I wrote back to him immediately and said, please do not forward this to anybody, because you can only imagine the kind of potential risks to their safety and security and that to their families if people start targeting their homes. And I urge everyone who is listening to this show to make sure that the privacy and confidentiality of people who are affected is respected to the highest degree.
Just 30 seconds, Dr. Shetty, a final word from you to those today who are going through some kind of stress and trauma. What would you suggest to them?
Breathing exercises, yoga, relaxation before you sleep. See that you maintain your sleep. Share your feelings with your family. Share your feelings with your close ones. Indian parenting is not about mother and father, but it's pool parenting. A neighbor can be more effective to your child. Your maid servant might calm your child much better than you. Favorite teachers, favorite relatives should be used for calming the children, because many kids are getting very aggressive and very disruptive. These are the small things which we should use. Indian society is a community and it's not isolated families, and this is the mantra which every family should use. Never remain in isolation. There's no shame in sharing your feelings. There's no shame in saying I need help, and that I think should be the spirit for every Indian family across the country.
Dr. Shetty, Dr. Vikram Patel, thank you very much for speaking on a subject that perhaps needs far greater amplification, the social and mental costs of a national lockdown. Thank you both very much for joining me on the news today.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.